Live from Utah's first TV station, ABC4 News celebrates 75 years.
Welcome to ABC4 News at 10. I'm Courtney Johns. Thanks for joining us. We're beginning tonight with the Utah Department of Corrections tackling a scabies outbreak at the Utah State Correctional Facility. Officials saying they have confirmed at least 57 people have the highly contagious skin condition. The Utah Department of Corrections says the outbreak started in a section of the prison known as the Green Unit, which provides dorm-style housing for sex offenders and drug addicts. At last check, 57 people have scabies, a skin condition caused by a tiny burrowing mite.
We've identified a scabies outbreak. Our medical team that works for the Department of Health and Human Services has come in and they're quickly taking care of it. In the meantime, we've had to lock that particular area of the prison down to prevent it from spreading to other inmates and other individuals.
Assistant Deputy Director Spencer Turley says they've taken preventative measures, including educating the inmates on what to do, as well as provide treatment and medication to those who have it and sanitizing their belongings.
We're going to take all of their bedding, we'll isolate it, and then we'll launder it separately to ensure that we can launder it properly so all of the bacteria, if you will be washed out of it.
While they still don't know how scabies got into the prison, the Utah Department of Health and Human Services says there are several ways it can be contracted.
Skin-to-skin contact is the primary way. It's not as common, but it can sometimes be spread through sharing clothes or towels. But usually it's just skin touching skin. And, even as short as 10 minutes could be enough to spread the scabies mite from one person to another.
The department says scabies can take 4 to 8 weeks to show up after infection. So not having symptoms doesn't mean you don't have it, which is why anyone exposed should see a doctor as soon as possible so you can stop it before it gets out of hand. While it's common in places where people live close to each other, the department says it's treatable. You just need to know what to look for.
If you are having an itchy rash, to go see a healthcare provider who can get treatment. If you have had skin-to-skin contact for 10 minutes or longer with somebody who has scabies, you should go see your healthcare provider to talk about what your options might be.
Officials at the prison say other areas of the prison will be cleaned to prevent further spread, and that inmates and staff will also receive education about hygienic steps needed to protect themselves and others from scabies. We have more information about this parasite on our website. That's abc4.com.